Trans Healthcare 101, Prep for Trans Folks. This will be our third recording where we will be specifically focusing on PrEP in trans persons. I'm Helena Diane Cruz, 35-year-old transgender female from Memphis, Tennessee. And I'm here to educate you in and around PrEP dealing with us trans folk. PrEP is a daily pill that prevents HIV. In this video, I'll be providing some education about PrEP geared towards the trans community because PrEP is an amazing HIV prevention tool everyone deserves to know about. I will outline the basic information someone needs to know about PrEP, like what it is, how well it works, how to take it, how safe it is, and how to access it in Tennessee. After that, I'll give some context about what it's like to live with HIV. Then I'll talk through some of the reasons why someone might benefit from PrEP. At the end, I'll share some personal stories by different trans people about why they use PrEP. Finally, I'll share additional resources and what to learn more about where the information in the video came from. Even if you don't think you need PrEP, it may be that many trans people in your community could benefit from it and may not know about it. Please think about PrEP not just in relation to your own life, but in relation to the lives of trans persons or people you know, and consider sharing this information with them if you think PrEP could be beneficial to them. First, PrEP is a pill someone can take that will help them stay HIV negative, even if they're exposed to HIV through sex or sharing needles. Even though PrEP was first approved as an HIV prevention method in the US in 2012, many people still don't know about it. Trans people in particular may be less aware of PrEP than other people because we are often left out of the HIV prevention efforts and face so many barriers to healthcare access. Next slide, please. When taken daily, PrEP reduces the risk of getting HIV through sex by 99%. The statistics can be a bit difficult to understand. How to typically explain it is that PrEP provides nearly complete protection against HIV when someone takes it every day. To show just how protective PrEP is, out of 650,000 people using PrEP worldwide, there have only been 4 cases in history where someone got HIV when taking PrEP pill daily. That means PrEP is significantly more protective than condoms at preventing HIV. For comparison, the CDC estimates that condoms only lower the risk of acquiring HIV through sex by 63.91%, depending on the type of sex someone has. And just so you know, when we talk about HIV being transmitted through sex, we're mainly talking about certain types of sex. Some people never have the types of sex that involve a significant likelihood of transmitting HIV, like people assigned female at birth who only ever have sex with other people assigned female at birth, or people assigned male at birth who only ever have oral sex. I'm going to use anatomically terms just to be specific as possible and make sure everyone understands what I'm saying. Though I know as trans people, we often use other terms when talking about our bodies. Vaginal sex, meaning specifically sex that involves a penis inside a vagina, and anal sex, meaning specifically a penis inside a butt, are the only 2 types of sex that have a significant chance of transmitting HIV. Every other type of sex has extremely low to no risk of transmitting HIV, according to the CDC. The CDC considers the risk of getting HIV from oral sex to be so low that they can't even measure the risk. PrEP also provides good protection against HIV transmission through the sharing of needles. It's estimated to reduce the risk of HIV transmission through sharing of needles by at least 74 to 84%. Because of that, PrEP can be really valuable options for anyone who injects drugs, hormones, or silicone and thinks there's some chance they might end up sharing needles with someone else, whether they plan to share needles or whether or not they plan to share needles. And just to be clear, if someone uses new needles every time they inject, like by getting syringes from a syringe service program, a pharmacy, or ordering them offline, there's no chance that they would get HIV through injection. Next slide, please. How to take PrEP is most effective when taken every day. There are a lot of strategies someone can use to help them remember to take a pill every day if that's something they struggle with. However, even if someone struggles to take PrEP every single day, it's still protective to use PrEP because PrEP protective levels build up in someone's system over time. Think of it this way. If you take PrEP pills 9 days in a row and forget it on the 10th, studies show that you still have almost perfect protection on that one day you didn't take it. However, if you use condoms during sex 9 times and then on that 10th time, you forget to use a condom, you have zero protection from HIV the time that you didn't use the condom. A lot of trans people know how committed we can be to taking a medication if we see it as connected to maintaining our well-being. Because many of us take gender-affirming hormones and are extremely passionate about making sure we always have them. Many trans people have a similar level of commitment to taking PrEP daily. Because we know how much it improves our lives and it makes a difference in our experience of sex and relationships. PrEP is extremely safe to use, including for trans persons. PrEP can help any HIV negative person stay HIV negative, no matter who they are. It's not just for cis and gay men. PrEP, it's for us trans people too. Regardless of the specifics of someone's identity, whether rather they use hormones, rather they had certain surgeries, it's for trans women, trans men, non-binary people, cis women, it's for everyone. There's a lot of fear among trans people that different medications could interfere with our hormones levels and that we might have to choose between our transition and other parts of our medical care. Even though people worry about that a lot with PrEP, there is no reason for concern. I want to be very clear, PrEP does not affect hormone levels. It is safe to take PrEP and gender-affirming hormones together. PrEP is still very effective at preventing HIV for trans people who take gender-affirming hormones. As a transgender woman who is on PrEP and hormones, and speaking on behalf of other members of the Transgender Task Force who also use PrEP or hormones, I want all trans people to feel comfortable accessing PrEP. Like any medication, PrEP can have side effects. However, most people experience no side effects. And for the few people who do, the side effects are usually very mild and only last a few weeks. PrEP providers will monitor any PrEP patient for side effects. PrEP is considered an extremely safe medication. Next slide, please. PrEP is accessible in Tennessee. Regardless of someone's insurance status, citizen status, or income level, there are ways to get PrEP in Tennessee, almost always for free or for very, very cheap. We know trans people are more likely to be unemployed and uninsured than other groups of people. That can be a big barrier to accessing a lot of types of medical care, but it doesn't need to be a barrier to accessing PrEP. There are many organizations through the state that have PrEP navigators who can handle all of the paperwork and details of getting on PrEP, like communicating with medication assistant programs, pharmacies, and insurance plans. The website getpreptn.com has a database of PrEP providers and PrEP navigators throughout the state. Many gender-affirming hormone providers can also provide PrEP if you request. Some PrEP providers can offer PrEP through telemedicine by video or phone appointments. That can be a great option for someone with limited access to transportation or someone living in a rural area far from providers. Telemedication PrEP can also be a great option for someone who's concerned with privacy and wouldn't want people to see them accessing sexual health services for whatever reason that might be. As trans people, we know that not every is affirming of our identities or competent at serving our needs. And we're often reluctant to seek medical services out of fear of being misgendered or otherwise mistreated by the person or people who are supposed to be caring for us. Unfortunately, because PrEP is associated with LGBTQ people and because HIV is so stigmatized, some medical providers still don't know about PrEP or aren't comfortable prescribing it. However, there are still many good PrEP providers out there, including in Tennessee. I work as a PrEP navigator in Memphis. And there are other trans people working in the PrEP field in Tennessee and across the country who are trying to improve PrEP access for all of us. If you have a good experience accessing PrEP as a trans person, please spread the word amongst your friends. And if you have a negative experience, please reach out and let our task force know so we can strategize about how to improve things for all of us. You can find us online at www.hivtn.net/EF. Next slide, please. I think that when talking about PrEP, it's also worth letting people know what it's like living with HIV these days. Sometimes people are afraid to get HIV tested because they're so afraid of the idea of getting HIV. But HIV has changed since the 1980s. So before I go on to talk more about how PrEP could benefit someone, I want to make sure everyone knows about HIV treatment. People are often really afraid of getting HIV because they think they couldn't afford HIV treatment. We we have all known people who have needed to raise money from friends and strangers for medical treatment of all sorts on crowdfunding websites, GoFundMe, especially people who've had to raise money like that for transition related surgeries. So it's no surprise that people worry that they couldn't afford HIV treatment. Please know that HIV treatment is accessible throughout the United States, regardless of someone's income, insurance status, or citizenship status. Even though other types of medical care can be hard to access, there are programs set up to ensure people can get HIV care even if they are unemployed or uninsured. Most people pay nothing at all for the HIV care that they receive. The HIV treatment we now have works so well that it can help someone living with HIV the same lifespan as an HIV negative person. People living with HIV can have long, fulfilling lives just like HIV negative people. People also worry about getting HIV because they think they could never have intimate, anxiety free sex with someone ever again, and that they permanently pose a risk to their sexual partner's health. But here's something very few people know. Even though it's the best news we've had in the HIV world in decades and totally changes the lives of people living with HIV and their partners, if someone takes effective HIV treatment as prescribed, then their viral load will be suppressed to an undetectable level. If their level load is undetectable, they cannot transmit HIV through sex. We use this slogan, U equals U, which stands for undetectable equals untransmittable, to help make sure everyone knows this updated information about how HIV transmission works. Again, a person living with HIV on effective treatment cannot pass HIV on through sex. Next slide, please. Now, I want to discuss how PrEP can improve someone's life. Aside from keeping someone HIV negative, there are three main areas of life PrEP can improve that I want to focus on. Number one, HIV anxiety. Number two, sexual pleasure. Number three, control over your sexual health, which happens to be my favorite. Number three. Next slide, please. HIV anxiety. That was number one. A lot of people have been terrorized by the HIV epidemic, especially many trans communities. We have been taught to associate sex with risk, danger, and disease. That's made even worse by homophobia, transphobia, sexism, racism, and other varieties of prejudice. Sex for pleasure and sex outside of marriage or committed relationships is still very stigmatized. Many people feel a lot of shame surrounding their sexual desires and experiences. Sexual violence and domestic violence are also widespread issues, especially against transgender people. PrEP isn't a cure for homophobia, transphobia, sexism, racism, or rape culture. However, PrEP can significantly relieve anxiety about getting HIV through sex and having to experience the sorts of stigma and sexual discrimination that people living with HIV experience. Many people spend a lot of time before, during, and after sex worrying about HIV. They might interview possible partners before sex to try to find out how risky they are in terms of HIV, which can be a process for everyone involved. They may fear getting HIV test or avoid HIV testing at all because the whole subject is too terrifying. Even for people who've always used condoms perfectly every time they've had sex, they may experience a significant amount of anxiety worrying a condom may break or worrying a partner may secretively take off a condom during sex. For people in relationships with a commitment to only have sex with each other and be monogamous who don't use condoms in a relationship, they may worry about HIV being a potential consequence if their partner has sex with someone else without their knowledge. When using PrEP daily, someone can have an almost complete confidence that they will stay HIV negative in a way that's simply not possible by using condoms or by only having sex in a monogamous relationship with people you think are HIV negative. Many people who use PrEP describe that it's allowed them to have sex without fear of HIV for the first time in their lives. Next slide, please. PrEP can also help someone experience more pleasure in their sex life, which is really valuable and important, not just a side benefit. Sexual health is about more than just avoiding disease. It's about getting to experience pleasure. Because PrEP can relieve HIV anxiety, it can allow people to actually enjoy sex to a degree they weren't able to before. Because they're not so overwhelmed by worrying or shame related to HIV risk, many people hadn't even noticed before starting PrEP how much fear of HIV was preventing them from being able to fully enjoy the sexual experience in relationships. Additionally, with PrEP, staying HIV negative doesn't have to require you to restrict anything about how you express yourself sexually or who you connect with sexually. Until PrEP, all the other ways someone had to stay HIV negative required them to avoid certain partners or skin to skin contact in certain types of sex. PrEP enables free sexual expression without the restrictions imposed by HIV risk. For example, because of fear of HIV, some people may be afraid to have anal sex specifically or any type of receptive sex. Have sex with people they don't know well, have sex with more than one person during the same time in their lives, have sex without condoms, or have sex with people living with HIV. Avoiding these sorts of things when you otherwise want to engage in them solely to avoid acquiring HIV means missing out on sexual experiences that may hold a lot of meaning and fulfillment for you. PrEP can give someone the confidence to pursue the sort of sex they truly want to have without being held back by the threat of HIV. PrEP can keep someone's HIV negative no matter how they have sex or whom they have sex with. Next slide, please. Finally. Finally, PrEP allows an HIV negative person to have control over their own sexual health, regardless of what their partner does. Without PrEP, people have needed to depend on the person they're having sex with to help them stay HIV negative. For example, by wearing a condom properly or by being monogamous and not having outside of their relationship. By using PrEP, someone doesn't have to depend on their sexual partner's willingness to wear a condom while having sex with them to stay HIV negative or their willingness to be monogamous. That can be especially important for us as trans people because we may deal with sexual partners pressuring us more often than cisgender people experience. Even if someone's partner coerces them or pressures them, PrEP can still protect them from HIV. PrEP doesn't require any negotiation or communication with the sexual partner. Someone can take PrEP without their sexual partner or partners even knowing they're taking it. No other HIV prevention method gives someone that type of freedom and privacy. Next slide. I wanted to finish this virtual session with a couple of stories from trans Tennesseans about their experience using PrEP. This first one comes from a gay trans man in Nashville. PrEP has allowed me to have the sex life I've always wanted to have. I started PrEP before I was sexually active in ways that could transmit HIV. I knew that I wanted to have certain types of experiences, as I got further along in transition, and I knew PrEP could help me do that safely. Ever since I started PrEP, I've never once worried about getting HIV, not even when I got a call from the public health department telling me a recent sexual partner of mine had just been diagnosed with HIV. It was life-changing for me to learn that PrEP does an even better job stopping HIV transmission than condoms do. I think I've been very nervous relying on condoms to protect me from HIV, especially with the strangers from Grindr. Since I'm the receptive partner, I have less control whether a condom is used than my partner does. PrEP has given me confidence when having casual sex. I love that my protection from HIV doesn't depend on what anyone else does at all. In that, it doesn't even depend on what I do while I'm actually having sex with someone. It just depends on whether I take my PrEP pill every day or not. I used to think it would be really difficult for me to ever be in a long-term relationship with someone living with HIV because I thought we could never have sex without condoms, without some level of HIV transmission risk. No matter how committed our relationship was, PrEP and you equal you changed that for me. Now I don't need to care about someone else's HIV status at all because by taking PrEP properly, I'm taking responsibility for my own sexual health. And that was again a testimony from one of our trans persons here in the state. Next slide, please. And so concluding that, we have went over several of the options in obtaining PrEP. We've kind of dealt with minimum knowledge on what PrEP is, how PrEP works, and the fact that PrEP is great for all people, including trans persons taking hormones. It's not going to affect either way your levels or affect your transition. It's only going to, what I like to think, because I myself am a trans person on PrEP, going to make you feel more confident and more safe in your endeavors in life, may they be sexual or anything else. In saying that, I like to give a personal testimony. I've always been a not outgoing person when it comes to sex, but inside, I think that's what I wanted to be, but didn't feel comfortable doing it because I work in HIV, in the HIV arena. So when working in the HIV arena, you are always aware of the stats, the statistics and the numbers and everything surrounding HIV. You are very, very aware. And that awareness does not leave or stop when you clock out. You take it home, you take it to the bar when you meet a new person, you take it on the website when you meet a new person, you take it everywhere you go, just because every day that is what you see. And although you know it's not a life or death issue anymore, it's not a death sentence, you still see those people in their initial reaction when diagnosed. You feel for them and you want them to know that their life is not going to be over, that they can still have everything that you have. And then at the same time, you want to be careful because you don't know how you would react if that happened to you. Although you know everything, you still don't know until it happens. So that carefulness, that anxiety, all of those things that I read about to you all, I faced until I got PrEP. Once I started taking PrEP and they check your levels and tell you, okay, you're good, you're safe, you have enough in your system, you realize that you do want to try new and different things. But that anxiety that you had working in the field and knowing all that you know kept you from doing that. And some of those anxieties that kept you from doing that roll over into your everyday life. So to be able to take PrEP and to be able to freely experience sexually things that you've always wanted to try and not have to worry about going to work and testing positive, it is a part of your life that doesn't have to be anxiety driven when so many other parts do have to be. So for all of my trans persons, trans people, I always tell them that we know the demographics that we deal in. We know who we are. We know the risk factors. We know that we should be on PrEP if it's available. And that's what I'm to do. Make sure that everyone has access to PrEP because it is available. Next slide. And that's it for today. We're planning more short videos on trans health topics. So if you have any ideas, go to the website and let us know what you'd like to see next. Thanks for listening, and don't forget to stick around for the live Q&A session. Starts now. The link to join the Q&A is in the description box below this video. I'll see you there.